welcome everybody to this seminar on the key outcomes of ageing with HIV. This is from the conference that was held in Kiev in May 2018, New Challenges and Unmet Needs of People Living and Aging with HIV/AIDS aged 18 to 50. My name's Jackie Morton and I'll be the moderator for this webinar. Just to give you some insight, you should have on your screen the how to use the controls, and Maria has put it at the end of the session. We'll have a question and answer session, and if you want to speak, there's a little button where you raise your hands and she will be able to connect to you, or if you write your question in the question box, then we can use that and answer your question at the end, hopefully. Purpose of this webinar is just to capture the key outcomes of the conference for EATG to address from a scientific policy and training perspective. There's 3 speakers today that will present their key outcomes: Giulio Corbelli for scientific research, Isabelle von Lingen for policy, and Mario Cascio for training, and Mario will also pull together the conclusions of today. The webinar will last about 45 minutes, with each speaker presenting for about 10 minutes. And then there'll be a chance at the end of the session for you to ask any questions. Just to give you an outline, the 3rd conference with aging is part of a project that EATG has been running, aimed to better understand the current and specific needs of people living with HIV and aging with HIV and AIDS. This last one was aged between 18 and 50. And how it contributes to the development of a more focused responses for this population. As you know, there's been 3 different phases of people living with HIV and AIDS age 50 plus, children and adolescents aged from birth to 25 years, and people who have lived with HIV and AIDS for at least 10 years in the aged 18 to 50. The main activities that we've gone through have been a series of thematic webinars and stakeholder conferences. So without further ado, it's my pleasure to welcome you all and also to introduce our first speaker today, which is Giulio Corbelli, who will present the key outcomes for the scientific research. Over to you, Giulio.
Thank you very much, Jackie. Thank you everyone who is attending this webinar. As you can see, I just have one slide trying to summarize some of the concepts that have been discussed during the last conference on aging with HIV, related to people in the middle years of their lives. So as a first point, I would like to focus on this concept, which is not exactly maybe an objective for scientific research, but it's more a way to perform scientific research related to this population and in general, which is patient-centeredness. This kind of approach has been introduced in the first days of the conference by Professor Richard Harding, related to the opportunity to use some outcomes coming exactly from the patients themselves in the research, in the scientific research, and also in the way the health services are organized in order to adequately respond to the needs of the people attending them. So patient-centeredness means something that you are not going to start a scientific research project or program without asking the people you are planning to involve what they expect, what they want to from this project and from this program or intervention in general. It is a way to inform the scientific research, which is guided and orientated by the people who are going to use the research themselves. So it is not a new concept, but it is still a concept which is not that common in scientific research in general. I think that for an organization like the European AIDS Treatment Group and for the European Community Advisory Board, specifically, it is so crucial to take this role to inform the scientific research so that this can respond more and more to the needs of the people living with HIV. And I also think that the way Professor Harding illustrated the tools that we can use in this sense, like the patient-reported outcomes measures and other quality of life measurements within the scientific research are much important. Most of the people in this age, they can manage to live their condition of people living with HIV from a clinical point of view usually. But there are several other factors which influence their quality of life, and consequently they can also influence the, for example, the adherence or in any way the outcomes, the health-related outcomes in their life, also the clinical outcomes themselves. So I just want to highlight how important is this concept in general. This has also to do with the second bullet point, which is related to the research to better understand the psychosocial impact of HIV infection. Because if you take into account the patient-reported outcomes, of course, anything which is really important for people living with HIV is taken into account and is used to inform and to shape the research and the intervention and also the routine care for people living with HIV. There are then some scientific research needs which are related to the lifestyle of people living with HIV aged 25, 50. Because, for example, the use of recreational drugs is pretty much common in this age group, but also other lifestyle factors which may influence some comorbidities like non-communicable diseases and other comorbidities in general. I still think that we had some very, very good presentations related to these aspects. We still miss some information, some scientific information related to interaction between HIV drugs, for example, HIV medicines and recreational drugs, or other substances like alcohol, or also other medical other medicines which can be used during in this age group. Also, we need data to inform strategies who can help people living with HIV prevent non-communicable diseases like cardiovascular disease or other bone disease and so on, which are more related to, for example, the kind of food we have and other lifestyle factors, or the physical activity we do and so on. But this kind of information we need should be as closer as possible to our needs, meaning that we should try to approach them in a way which is not which can allow us to shape our lifestyle in a way which is satisfactory for us, but nevertheless healthy as much as possible. And the same applies also to the co-infections and neurocognitive impairments, which must be prevented, or which could be prevented also by adopting a more healthy lifestyle. The last very important point which we had in the discussion about the scientific research is related to other subgroups, so to say, or specific groups of population within this age group. In the slide, you can read that some groups are mentioned, like sex workers, trans people, and prisoners, which were at the focus of three very brilliant presentations during the conference. we all know that these groups have very specific needs, and that there is very little efforts from the health institutions to respond and to address those needs. I think that a very important point has been raised during the conference, which is that the fact that any successful intervention for specific communities must come directly from the community themselves, or with a strong involvement of the community themselves. This is what the approach that also EATG tries to have, trying to inform the activities and also the advocacy points based on the needs expressed by the people themselves. What must be done is to facilitate and to make an environment where this group of people can advocate for their rights. I think that everybody understands how difficult it can be, for example, for prisoners to advocate for their lives, for their needs themselves. This is a very peculiar situation which has been discussed in a brilliant way also at the conference, also given the fact that we were in Ukraine, where the situation for prisons are very hard for so many people. So I think that the role of our organization is exactly the one to facilitate it, to try to help as much as possible the people living with this in these groups to advocate for their rights, and to also raise their voices in case they are not allowed to do so. I think that this is more or less what, from my point of view, came out from the conference related to the scientific research need, and I'm happy to answer any question you may have also after the presentation.
Thank you, Giulio. As Giulio highlighted, if you can put any questions down on the question section, or raise your hand at the end of the session, we'll answer any questions then. So our next speaker is going to look at the key outcomes for policy, and that's Isabelle von Lingen. So over to you, Anne.
Good afternoon. So I will follow up on Giulio's short presentation, because as we all wish, evidence and scientific research should be the basis for policy making. So one of the key outcomes from the conference that I can see was there is a huge need to enhance the understanding of the impact of long-term treatment and the disease on people living with HIV. And that requires to improve monitoring systems and updating indicators and improving data collection, so that strategies that are put into place address real needs of people living with HIV. So for instance, they could help define what kind of prevention tools and strategy need to be implemented to improve quality of life and act as preventative healthcare. The second would be, after we would know what the issues are for long-term, is awareness of these issues among policymakers, community, health professionals. So that would be one. The second outcome that came out quite clearly from a policy perspective, and has already been mentioned by Giulio, was patient-reported outcome and patient-reported outcome measures that should be defined and conceptualized both by clinicians and by the communities, and should be implemented as all of our health systems are undergoing reform. It could be a way to improve the efficiency and effectiveness of healthcare for patients and of the system in general. Then, connected to this, there's a need to pull evidence, because this is still a fairly new area. Form and develop guidelines at European and local level, because we heard an excellent presentation that was already referred to by Giulio on patient-reported outcome measures from the UK, and a lot can be learned from it in other settings, of course, with some adaptation. But there's a need for more cross-sharing of information across settings. Then, as another sort of advocacy point from the conference that came out very strongly was the need to promote integrated care and support that are approaches that are based on people's needs rather than just on the systems, which has been a quite top-down approach. So and community spheres that provide different kinds of service, and see how to better integrate them. So one example of integration would be integration of mental health and physical health. As one of the speakers pointed out, the mind and the body are just one, and so there's a need to integrate different kind of care and support to the person. And then, as people face different vulnerabilities or issues, the services, should be oriented according to a person's need. And so again, this is the concept of patient-centeredness that Giulio mentioned at the beginning of his presentation. The last point, which is certainly not the last, the last point, which is certainly not the least one, and which was again already mentioned by Giulio, was the issue of stigma and discrimination. So we need to update the knowledge of policymakers and healthcare professionals on long-term management of HIV, because the knowledge of these actors are not necessarily up to the latest updated to the latest evidence, for instance, on U equals U. And that should help reducing the stigma, which can be driven by also lack of information. Hello?
Hello? Alice?
So again, this is where the issue of integrated care came into the picture again, as communities sometimes can address some of the needs of people who are furthest away from the traditional healthcare settings, and so they can provide this kind of bridging function, which again is calling for integration, therefore of more traditional and community services. And to conclude, one of the policy, I guess, ask should be at European or national level would be to increase and scale up funding for research, both on the medical issues that came out in Giulio's presentation, but also resourcing community services, which are part of this integrated response to long-term management of HIV. Thank you very much.
Thank you, Anise. Apologies if some of you had a little bit of a sound blip there. I lost a little bit of Anise's presentation through sound, but hopefully you caught it all, but if there's any questions, please ask them at the end. The next speaker is Mario Cascio, and he will be talking about key outcomes for training. So I'll hand over to Cascio, Mario, sorry.
Hello, thank you, Jackie. Good afternoon, everyone. My name is Mario, and today I will be speaking about the key outcomes regarding training and training needs which have emerged from this third conference on aging. Okay, the first point I want to talk about is about the fact that healthcare professionals and about the fact that many have little or no knowledge on the specific needs of people living and aging with HIV. And this is particularly true for healthcare professionals who come from other medical areas, such as cardiovascular disease, diabetes, liver disease, etc. Well, and now since we are moving towards a multidisciplinary approach in the long-term management of HIV, I think that a dialogue between different medical areas and providing adequate and specific training will be crucial. Another area of interest which has emerged from the conference is that of, as Giulio has already mentioned, and Anis, is that of patient-related outcomes and how these can play an important role in research and medical practice. So it's important for us to inform and people, community, and working in the field about the importance that these can have in the future management of people aging with HIV. A third point was that about the complexity of modern health systems and the importance for community organizations and for activists in understanding the issues related to service delivery and the use of health technology assessment. I think this is a crucial point also in which we must, upscale our training, our training towards communities especially. Another area to investigate is that of stigma, discrimination, and criminalization, and how quality in life can be strongly impacted by these. Well, we've seen that from many presentations that this has emerged very frequently, and so it is important that we start investigating more into this area and having people get the better knowledge of what are the elements of the stigma, self-stigma, discrimination within the healthcare system, criminalization by in some countries for some groups of people. And the fifth point regards sexual and reproductive health and the importance of raising awareness among both people living with HIV and also healthcare professionals and how these can reflect on the well-being of a person, especially for when we have seen from a couple of presentations we had in Kiev, especially for women living with HIV. In this age group, 18-15, which is the age group of reproductive health, of course, this has a particularly significant importance. Then, going on, we can see that mental and social well-being, mental health and psychosocial well-being, which has emerged across all three aging conferences, both in the older people, 50 and older, and the younger ones, and also in this age group as well. Well, healthcare professionals and people living with HIV should be made aware of how this underestimated issue does indeed play an important role for optimal care. The next gap which has emerged is that of people living with HIV, the fact that people living with HIV need to be empowered to enable them to adequately manage the many health-related issues they will be facing due to the many years living with HIV and the many years on treatment. In the same way, community-based organizations need to be provided with adequate training on these issues in order to advocate for optimal long-term management of HIV. For this age group, effective prevention and management of comorbidities represents a key issue. Further research is therefore needed, as Giulio had already mentioned, and guidelines must be constantly updated, as Anis had mentioned before. Integrated services and the role of community. Well, since a multidisciplinary approach and patient-centered approach will represent the future of HIV care, what role can community play in the design and implementation of this holistic approach? So we must be learning from this and try to give our contribution in the design of future HIV care. Prison health, this is something I have always been particularly interested in, And there was a very good presentation at the conference in Kyiv. Well, in order to achieve an adequate prevention and care in prison settings, prison staff must be adequately trained on the basics of HIV and of other communicable diseases, and in understanding the specific needs of people living with HIV. In the same way, prisoners should be provided also with adequate education. This approach has proven to be effective in reducing stigma and also in encouraging a proactive attitude from prisoners themselves. One important point which has emerged from the conference is the important role technology can play in the long-term management of HIV, both for people living with HIV, but also for healthcare professionals. It is therefore important to be constantly updated on which tools are currently available. Another specific training need would be data on harm reduction and on how this approach can be used and under which forms in the reduction of harm, for example, in chemsex practices, which emerged from the conference, for example, in one of the sessions from Giulio himself. The last point here is about how healthcare professionals should be trained in understanding the specific needs of multi-vulnerable populations such as sex workers, migrants, people living with people who inject drugs, etc., allowing an adequate care to these difficult to reach groups. And that's about it. That's all.
Okay.
Anybody has any questions?
Thank you, Mario. Do we go and ask any questions now before we move on to Mario's summary of how these outcomes are going to be taken forward? Would that be useful? Is there any questions? Can everybody hear me?
Yes.
All right.
Yes, we can hear you.
Yes, here is a question I have received a question from Giorgio. What are the strategies suggested to work on comorbidities? Is there any intention to join forces with other patient groups?
I think this question is to me, or am I right?
Probably Giulio.
Yeah. Okay. Yeah. At ECAB, at the European Community Advisory Board, we have been talking for a long time now about trying to joining forces with other patient groups. Actually, we have had a great opportunity to do so in these years, thanks to the EATG project, which allowed us to be in contact with several other organizations for other disease areas. And for example, the model of the European Community Advisory Board was also helpful in informing similar activities for other patient groups. But related to the problems of comorbidities for people living with HIV, I think that the most important part would be to try and involve in our work other organizations of physicians working in other therapeutic areas more than patient groups, even though, of course, to have a more helpful and effective interaction with the organization of physicians, the help of the patient groups of that disease area could be very, very important and helpful. And for sure, we should not interact with the organizations of physicians or clinicians without informing and involving also the patient groups. But I think that the most important part would be to, as Mario was saying in his first point, is to try and inform also an adequate knowledge of the problems related to living with HIV among healthcare professionals, not only healthcare professionals, but mostly healthcare professionals working in other diseases area. We could not manage to do so far for time being, but I think this is an important advocacy step to be taken into account for the next years.
Can I add something?
Sure.
Okay, I wanted to add something to what Giulio was saying and what what was asked before. Okay, one of the goals of this Aging with HIV projects, one of the expected outcomes, is that of was that of informing many local organizations around Europe and raising awareness regarding all the issues, which among these, of course, comorbidities have a prominent role. And so I think this project has been important because many local organizations have had the possibility of how do you say, coming to terms with these possible elements in the long-term life of people who are living with HIV. So this is, I think, one important step that we are contributing in, because of course putting the different organizations together will be important. But first of all, we have to raise awareness around the issue. Not much is always being done. In Italy, for example, there have been very good examples of some conferences which have been organized by scientific members, people from the clinical field, but they have been done together with community, okay, in which they have started to tackle, for example, some of these issues about the quality of life of people of living many years with HIV, and also about involving also other medical areas. For example, there's been an interesting interaction with geriatrics this year. And so this is something I think we should support, and we should try to disseminate and encourage other groups to do as well.
Have we got any other questions? Anything come through, Maria?
Okay.
No more questions at this point that I can see. Thank you.
Okay, thank you. Mario, would you like to sort of finalize this webinar on how we're going to take forward the recommendations and outcomes from this aging project?
Okay, I will talk about the next steps, the finalization of the Aging with HIV project. Okay, as you all know, okay, the uniqueness of this project was that of considering aging from a lifestyle perspective. Okay, we've taken into consideration 3 age groups. Usually when you talk about projects on aging with HIV, you always think about people 50 and older. Okay, so our uniqueness has been that of having taken into consideration 3 age groups, which was that also people from 0 to 25 and people from 18 to 50, like the one we've talked about today. Okay, this will enable us, because there will be the next phase of this will be that of consolidating the recommendations from all 3 phases. So this will enable us to give to pinpoint the parts which are in the recommendations, which, let's say, go across all 3 age groups. But at the same time, it will give us the possibility of also identifying specific needs of specific age groups. So this will be very interesting to see the final report with these recommendations. So this final report with these final recommendations will be launched at a stakeholders meeting during the Glasgow HIV conference in October 2018. Of course, after that, there will be a plan for the dissemination of these recommendations. Okay, currently we are working also with, for example, the HIV, collaborating with HIV outcomes initiatives, which moves mostly on the policy issues related to long-term management of HIV. And we're also working, we'll also be collaborating with AX on trying to provide input and updating the guidelines also in this area on comorbidities and on the long-term management of HIV. And also we are starting to identify other medical areas in which to interact. ECAP, for example, could be a good basis for this, for the future of our work there. At the same time, we also have EAT, the European AIDS Treatment Group, has a COPE project, which is a project which provides grants, small grants for translations and development of materials. Well, we have decided to make a call to provide some grants for translations or development of materials which are related specifically to the aging with HIV issues. And of course, after all of this, we will follow up with some projects and activities which will be mostly based on our findings and what we will identify as priorities.
Thank you, Mario. Is there any further questions anybody would like to ask following the 3 presentations and the final next steps by Mario? And Maria's put on the screen how to put your questions forward, either by raising your hand, which is a little hand on the internet, or you can write your questions in the questions section and Maria will pick them up. Just whilst we're going through that, Mario and Giulio and Anise all highlighted some very key important things about putting the person at the centre of everything that we do. And many of you are within communities or work within communities, and it came out quite clear at the conference that sharing good practice, helping others understand how others are implementing systems, processes, ways of communicating in their own areas is really important. And if you feel you have anything that you are doing within your own area, like Mario's just highlighted what happens in Italy, it would be really good to hear from EATG members so that we can capture good practice in these age groups and share that amongst all of us and to others, partners that we're working with. Have we got any questions, Maria?
No questions, at least not on my screen.
Okay. Well, that really concludes our webinar then. If you suddenly come up with a question afterwards that you feel that you want to ask, just let Maria know and she will certainly connect with any of the speakers so that we can do a response. But I would like to thank you for joining the webinar today, and Maria's put up on the screen where you can get further information about the Aging Conference and also about EATG as an organisation. And there's the website connection on the screen at the moment, and also the hashtag and Twitter and all these other things, the way that you can get involved in hearing what we're doing as we progress with the work and the key outcomes that Mario's alluded to. Thank you, everybody, and have a nice day.